Hi everyone, we're going to work on a fetal screen today, and we're going to use a fetal screen, and what it is utilized for is to detect Rh positive cells in a mother's bloodstream, okay, from after she delivers a baby. We want to see if any of those baby's blood cells have mixed with mom's blood in her circulation. And so we're going to set this up, and then I'll explain a little bit of how the test works. So let's get our tubes ready. And what we're going to do is we're going to have a patient, and I'm going to have 2 patient tubes here because in this one I'm going to make out my 3 to 5% cell suspension, or sometimes you're going to see some of your procedure manuals may say 2 to 4. And then I'm going to have my test tube right here that I'll perform the test in. I'm going to do a positive control, and I'm also going to do a negative control so we can see those results today. So there's my tubes. I'm going to take them and put them right here in the rack. And then here's my sample. So I'll get a pipette from up here. I'll get a little drop of blood from down in here. Mix this in there. I'm going to add my saline, and remember, don't put the tip in the tube. We don't want it contaminated. So enough saline in there to make our suspension, and that looks pretty good. And so at this point, what we're going to do is we're going to add 1 drop to the tube marked patient. Then I'm going to put 1 drop of my positive, and remember, you want to mix your reagents well, okay? And even squeeze that dropper to make sure you mix anything that might have stayed in the dropper. 45-degree angle, and we want to put a drop in there, and that's the positive control. Squeeze that out. Okay, here's our negative control. We're going to mix, squeeze that, and then we're going to put that drop in there. Very good. Now, the next step that we want to do is we're going to put our anti-D reagent in there, okay? And then I will explain this. I have a little picture here we'll talk about. So we put 1 drop into each of our tubes, and then we're actually just going to set these back here for 5 minutes to incubate. So I'm going to set my timer, and depending on your manufacturer that you get your fetal screen from, you may have slightly different incubation times and so forth, and you'll just want to follow the standard operating procedure or SOP at your facility. Okay, so now let's talk about what's going on in that tube and why we're doing this. So you can see this here. I have some little notes that we're going to talk about. Now, a fetal screen, so here's our fetal screen that we're performing, is only done on an Rh negative mom. Okay? It can only be performed on an Rh negative mom. And we're only going to do it on a mom that actually has an Rh positive baby. Okay? We have no reason to do this on a Rh negative mom that has an Rh negative baby because she doesn't need RhoGAM. Okay? And that's because, okay, we're only doing this on Rh negative individuals, okay? And that's because for a fetal screen, what we're detecting are Rh positive cells, okay? And I'm going to designate those like this, okay? So I'll make a couple little pictures that we'll talk about as we go through this. So remember, a fetal screen, this is very important, a fetal screen, okay, detects Rh positive cells. And you're only going to do this on an Rh negative mom who's had an Rh negative baby. Okay? So let's talk about now what's going on in these tubes that are incubating. Okay. So what we've done, here's an example, and I'm going to actually just draw us a new picture here. Oh, that didn't tear very well. Let's get something that looks better. Okay. No, that didn't help. So here's our test tubes. I want you to see this. Okay, and this right here will be our patient. Okay, and then I'm going to draw a picture so we can compare these of my negative control. So here's my negative control. All right. So in here, we added these cells. Okay. And my negative cells are in here, and we're going to put them in here as negative. Okay. Now we're doing this on a mom who is Rh negative. All right. Remember that. And she had a baby that was Rh positive. Okay, here's my Rh positive cells. Oops, put the plus there. And what we've done, we've added, remember this anti-D, this is anti-D, so it's antibodies to D, right? So this is how I usually draw that. Got a little D on there, so we're going to put that in there, right? And it is going to attach to these D cells, right? See those? And we're going to add it over here, but there's no Rh positive cells for it to attach to. See them in there? And these aren't going to attach to mom cells because those are Rh negative. And so during that 5-minute incubation, we're letting that antibody essentially sensitize these Rh positive cells that are in there. Here's a bigger picture so you can maybe see that plus sign. Okay? All right. So we'll be right back. Okay, time's up. So our tubes have sat here and incubated at room temperature for 5 minutes. And now what we need to do is we need to go put these in the cell washer and wash them 4 times with saline. And we'll talk about what's going on when we do that. So I'll be right back. And we're back. So these guys have washed. Okay. And now what we're going to do is we're going to add 1 drop of indicator cells. Okay. And these indicator cells are Rh positive cells. And I'm going to draw you a picture here after we add these. So 1 drop into each of these. 45-degree angle. Working on that. Okay. Nice job. Indicator cells. Now what we want to do is resuspend those all in there. Give them a mix. We're going to go put them in the centrifuge. Okay, so while those are in the centrifuge, let's talk about what's happening in our tubes. So I'm going to draw a picture of our tubes again. Okay, and this will be our patient. So we'll put patient up here, PT, and then right here, we're just going to look at our negative control. And there's our negative, and here's our patient. Okay, so once again, remember, this is an Rh negative mom. So we have these negative cells in here. And our negative control, again, those were all Rh negative cells. But what we're also looking for in here were those baby cells that were positive. Okay, so let's draw a couple of those. Because normally, you're going to have a couple of those baby cells that get into the mom's circulation just during a regular normal delivery. Okay, and so what we're using this fetal screen for is to determine if they had a normal amount or an increased amount. Okay, so we added that anti-D reagent, and so those attached. And then what we did, that incubated for 5 minutes. And if you remember, so this picture here shows you that reagent's all through there. Okay, so we washed it, and in the washing process, we washed any antibodies away that were unbound. Okay, so now we have just the cells. If there's positive cells with antibody on them, that's what's left in the tube. Then we're going to add indicator cells. Now, what our indicator cells are Rh positive cells. Okay, so we're going to put them a drop in each of these tubes, and what's going to happen in our negative control is essentially nothing. Okay, we're just going to have free-flowing Rh positive and Rh negative, okay, red blood cells floating around in there. But now our patient that had some originally Rh positive cells with some antibody on them, these indicator cells are now going to attach. Okay, and while they're attaching, Okay, now we're going to see clumps. And so that's why these are indicator cells. There's positive. Okay. So we're going to see clumps, or what we actually call them are rosettes. Okay, that's what we're looking for in a fetal screen, are those rosettes. And you can't see them macroscopically with your agglutination viewer. You have to take these to the microscope, okay, and look at them under the microscope to see those. And I'm going to show you how we do that next. Okay. Okay, so to view these rosettes under the microscope, we have this nice little holder here. This holds the tube, and I'm going to show you how I've typically done these in the past. So you take your tube here, and you gently want to resuspend this. And you want to do this really gently because you don't want to break up any rosettes that might be there. So we're going to suspend some of our specimen there, okay? And then we're going to put it on this holder here. And then we want to focus. Now, as we're focusing this, we also want to be rotating it. Okay. Oh, I have that a little too close there. There we go. Okay, so while it's on there, so we want to be looking at it, and we want to be focusing it, and actually rotating that tube so we can view those cells flowing, okay, freely in that suspension through our microscope. Right? And then we would look at our negative, our positive, and then our patient. And what I'm going to do is I'm going to put this on the recording microscope and record those images so you can see what they all look like. Okay, so why do we do a fetal screen? And so that's one thing we really need to address right now in looking at this. So a fetal screen is utilized. Remember, it can only be used for an Rh negative mom, and that's because we're looking for Rh positive cells. Okay? If we did this on an Rh positive individual, we would see positive clumps everywhere. Okay? So this is only on an Rh negative individual, and we want to see if there was a normal fetal maternal bleed. And we do that by looking at 4 to 5 fields under the microscope, and if we see 4 rosettes or less, that's a normal bleed. Okay, so those rosettes, we're going to see them, as little clumps like this. And so we should see, 4 or less, and that's normal. And under normal, we're going to give 1 vial RhoGAM to the mom, and that's good. Now the problem arises is if we see more than 5. Okay, if we see more than 5 of these rosettes under the microscope, okay, in this fetal screen, we have to do something more. We have to quantitate how much of the baby's blood got into the mom's bloodstream, into her circulation. And in order to determine that, we have to do a Kleihauer-Betke. Okay? That Kleihauer-Betke, okay, is where we make slides and we do a special stain on that. And I'm going to have another video going over that with you guys. But it's important to remember that the Kleihauer-Betke detects specifically fetal cells. Okay? And that's a huge difference between our fetal screen and our Kleihauer-Betke, because our fetal screen, okay, here's our fetal screen. Our fetal screen detects what? Okay, it detects Rh positive cells, where our Kleihauer-Betke specifically detects fetal cells. Excuse me. All right, that's all. Until next time, signing out. Here is an example of a negative fetal screen. You don't really see any clumps on this one. Now we're moving into a picture of, there's a rosette. There's an example for you. And on this one here, as you're scrolling through, there are a lot of clumps on this one. Okay, so you can see that. You need to look at 4 to 5 fields to establish and get your estimate of your fetal screen. There you go. Thanks, guys.